So what we're going to do is just real quickly show you how a clear overlay should fit and how it's delivered. And what we did is we made some clear overlays for him. We took the impressions at D-band, and that was only a few hours ago, and we made the clear overlays using an Ercoform machine or a BioStar. And what you should do is the clear overlays should fit exact. There shouldn't be any play in the clear overlay at all. It should go right to place and it should be fairly snug. So this is his upper clear overlay. So when we put it on, what you want to do, since he just did have a D-band, sometimes the gums are a little bit bulbous and you want to make sure that the clear overlay does not actually impinge on the tissue at all. And this one touches the tissue, but it really doesn't impinge. And most importantly, when you put this thing on, it should go right to place. It should fit really snug, and there should be no rocking or movement in it whatsoever. That way it'll keep the teeth as closely to the D-band spot as possible. So this one fits very well. When you take them off, you instruct the patient to kind of wiggle them back and forth just a little bit by grabbing the edge and the flange, not to pull on it and take it off one side and then the other. You want them to take it off evenly. So this one fits very well. There's no room between the incisal edge of the tooth and the clear overlay retainer material at all. Alright, we'll see if the bottom one fits the same. And the bottom one does fit the same. It goes right to place. And again, make sure that the flange is very smooth. You take it to the lab and you make sure with a rubber wheel that the flange is very smooth, and that it's not impinging on any of the tissue. It's a little bit fogged right now. The material itself is cool and the patient's mouth is fogging it just a little bit, but after he gets a little bit of saliva in there and or it heats up to body temperature, this will be very clear and you won't be able to see it. So with both of them in, it should go right to place and should give you a nice retention. Okay, now the instructions for wear on these are: you wear them 24/7 except when you eat. And since they are plastic and acrylic and they can break or bend, they either have to be inside the case itself in their pocket or on their teeth. When these things are on the teeth, they're very strong and almost unbreakable when they're on the teeth. When they're in the case, of course, they're not going to break. Once they go into somebody's pocket or backpack, different story. To clean these things, you don't want to clean them with warm water whatsoever. You want to clean them with cold water with your toothbrush, and once a day. So again, just to recap on the care of these things, just make sure that you use cool water. Brush them once a day. You can use a little toothpaste. Use your toothbrush. Probably the best time to clean these things is in the morning. After you've worn them all night, they might get a little layer of plaque on there. So just brush them along with your teeth under cool or cold water in the morning, and then put them right back on. These are nice and clear right now. However, after being used for a while, they will turn a little bit opaque. And that's normal. That doesn't mean that there's any problems with them. It's just kind of a normal occurrence as the person is wearing them and as they're used.